idea to explain what CBT is, which is short for cognitive behavioral therapy. CBT is what's known as an evidence-based practice. Now, an evidence-based practice is a model of therapy that has been shown to be effective and efficacious for the treatment of a particular disorder. In this particular case, CBT, in its bread and butter sense, is tried and true for treating depression. It's been expanded to treat anxiety as well as a multitude of other conditions such as trauma and PTSD and specific phobias. In order to do CBT some justice, it's important that we talk about Aaron T. Beck for reference sake. Aaron T. Beck was the father of CBT and still is. He's 98 years old. He was born in 1921. He's an American psychiatrist who is regarded as the father of cognitive behavioral therapy. His pioneering theories are widely used in the treatment of clinical depression and various anxiety disorders. Aaron T. Beck also developed self-report measures, most famously known as the Beck Depression Inventory, which has always been the tried and true measure for depression since its inception. Today, you might notice that instead of the Beck Inventory, when you go to visit your primary doctor even, they may use what's known as the PHQ-9, which is a standard depression scale. It actually lists the questions and frames them in a way that helps to diagnose whether somebody's in the clinical range for depression and should be referred to mental health from primary care. The other form that's often used in conjunction with PHQ-9 is the GAD-7, which measures anxiety. GAD is short for general anxiety disorder. So we'll talk more on that at a later time, but that's just some reference for you. So Dr. Beck, Aaron T. Beck, is actually noted for his research in psychotherapy, psychopathology, suicide, psychometrics, and he's actually published more than 600 professional journal articles, and he's authored or at least co-authored 25 books. Dr. Beck, along with his daughter Judith Beck, founded the Beck Institute for Cognitive Therapy in 1994. It is this Institute of Cognitive Therapy that now certifies clinicians to practice cognitive behavioral therapy in their own practice. Getting certified in cognitive behavioral therapy is actually no small feat. It takes about a year of training and phone consultations, reports, psychoanalysis, review of those reports, and then you have to record multiple therapy sessions and then submit those to the academy to prove that you're following the tried and true model of CBT. I have personally been through this process and am certified through the Academy of Cognitive Therapy, and it has really been a foundational piece in my skill set in treating patients, and I highly recommend it to any therapists listening out there. Well worth the time. To provide you some more context, I'll be quoting from Wikipedia. Working with depressed patients, Beck found that they experienced streams of negative thoughts that seemed to pop up spontaneously. He termed those cognitions as automatic thoughts and discovered their content fell into three categories: negative ideas about oneself, the world, and the future. He stated that such cognitions were interrelated as the cognitive triad. Limited time spent reflecting on automatic thoughts would lead patients to treat them as valid. Wow, so what exactly does that all mean? The thing is, in a nutshell, it says this: we are not taught to think about our thinking, and so we tend to take all the thoughts that come across our mind as valid, giving them an automatic green light to dictate our moods without ever being checked for efficacy. CBT teaches us to challenge our thoughts to ensure that they are accurate, balanced, and complete, certifying that the emotions they elicit are within reasonable interpretations of their context. So I had mentioned that CBT is an evidence-based practice. That just means it's one of many types of therapy that have been proven to be effective through the scientific method. Others include DBT, dialectic behavioral therapy, which is a treatment for borderline personality disorder, TCBT, which is for trauma, and other modalities, EMDR for PTSD, and so forth. So as I had mentioned earlier at the start of this podcast, this is episode 1, so we'll be jumping into the first of 12 skill sets for managing depression through the CBT modality. There are essentially 3 different pillars in these 12 skill sets, and the first pillar is made up of managing our thoughts and our emotions. The second pillar is managing our actions in relation to our mood, and then the third pillar is managing our interpersonal relationships in light of our emotions. And in each category or pillar, you'll find that there are 4 essential skills. So let's get to it. So the first skill we'll be covering is the connection between our thoughts and our emotions. It's really important to understand this connection because, like I mentioned earlier in talking about the history of CBT, we're not taught to think about our thinking. And so it requires a concerted effort to really examine our thoughts as opposed to just kind of letting them do what they do, which is come and go, right? The problem is if we let them come and go, then we'll just take our thoughts at face value. That elicits negative emotions, if we're triggered, and then we take those emotions, and then that leads to our behavior, which oftentimes results in outcomes that we're not so happy with. In the context of this discussion, I'll be covering the connection between our thoughts and our emotions, what a thought is and what it is not, how to distinguish between unhealthy and healthy thoughts. And so let's kick it off with connection between thoughts and emotions. So this category is the first of the three pillars I had mentioned that encompasses the basic skills in coping with depression through the lens of CBT. The other two are the connection between your mood and healthy activity and your mood and relationships, respectively. Now, in the mental health world, there's a little bit of a debate as to the whole chicken and the egg theory when it comes to our thoughts and emotions. It's the whole cause and effect idea. One school of thought holds that our mood and our emotions are derived as a direct result from our thoughts, and this is the most popular viewpoint. The other is just the opposite, or at least a mix of the two. In either case, when we're discussing coping skills for addressing mental health conditions like depression and anxiety, it is most useful to consider the former. So, what is a thought exactly? I mean, if we really stop to think about it, what is a thought? Well, in its most basic sense, a thought is either a statement or a question, or rather a sentence we say to ourselves, such as, I will wear my red shoes today, or I feel tired. These are simply statements, without any specific judgments attached, until we decide to give them meaning. An example of that, I can't wear my red shoes because they do not match my outfit. And if I do not match, then I will be judged by my friends. Herein enters the assumption. When we start making assumptions, we give value to our thoughts, values of perceived outcomes. So our feelings or emotions are varied. It is rather easy to say or identify our primary emotions, such as happiness, sadness, anger, remorse, guilt, or shame. Our other emotions also have a more kind of subtle connotation, such as curious, suspicious, envious, indifferent, ambivalent, vexation, regret, obligation, meh, for you emoji fans out there. In this post, I'll be referring to either healthy or unhealthy thoughts for simplicity's sake. Unhealthy thoughts encourage a state of depression and or anxiety. Healthy thoughts lead to an improved set of emotions that contribute to a mood that carries you throughout the day and a healthy pattern of thoughts, meaning that if you start with a healthy thought, that tends to start the train of thought that will carry you throughout the day, that will elicit healthier emotions, healthier behavior, which then sustains a better mood as it continues. Now, there really is no getting around it. How you think impacts how you feel. Now, as simple as that may sound, it's not so easy in its application, right? Because we can't just change the way we think. We think the way we think because of our experiences, our life, how we grew up, our role models, how we decided to make sense of the world, what we were taught. And so that's why we have triggers. And triggers are basically events that we are exposed to that upset us. Once an event takes place, then we have to decide how we're going to feel about it, how we decide to interpret it. Meaning, we have to distinguish and designate a thought to make sense of it, which is most often a result of how the event impacts us in context of its occurrence, meaning like how relevant is something to us. If you see a car accident on TV, okay, or on the news, it might be a little distressing, but you get a phone call saying that your sister was in a car accident, it has a whole different connotation. Let me give you another example. So you're leaving work and discover that it's raining, which you didn't expect, and you weren't prepared for it. The moment you attach a thought to the event, your feelings begin to follow. Now, this gets a little tricky because how we choose to interpret things depends on a few other things. First, there's our temperament. Some people are just naturally more pessimistic than others, whereas some are a little more laid back, like myself, in general. Now, secondly, there's context. If you just had your hair permed, then you may have a bigger issue than your coworker who is wearing a baseball cap when it starts to rain outside. Thirdly, we have to consider the skill set. This is what we are discussing in this discussion because it is the thing that you have the power to learn and affects change in your quality of life. The only factor you actually have control over is yourself, not the environment. Now we have to consider the process because the process of establishing our thoughts begins with our observations. Observation always comes before interpretation, even if we're not cognizant of it. Learning to observe mindfully will allow you to dictate your thoughts skillfully, rather than live kind of in an autopilot mode, where we just are going around reacting to everything, and only react when things don't go as we expect. I'll be speaking more about this in our next episode. So what is the application of this principle? Let's take in our rain example that we just discussed. If you choose to interpret the event as a neutral occurrence, you will likely make an effort to shield the rain by whatever means you have, to dry off, get in the car, go about your day. If you view the rain as the universe having kind of vendetta against you, acting against you yet again and again, then you will be flustered, resentful, on your way to your vehicle, becoming more irritable, and this emotion will be susceptible to further triggers by other events, such as traffic, and by the time you get home, instead of greeting your partner with a kiss, you greet them with an unloading of how bad your day was, even if in reality it was only the last 5 minutes of your day, and you forgot how nice the rest of it was. If you choose to view the rain as a positive thing, you will most likely develop thoughts of gratitude for its purpose and have an elevated mood and take its inconvenience in stride. Okay, so I hope you're still with me. I know this stuff can be a little dry, a little heavy sometimes, but this is really the nuts and bolts of why therapy works. And it's not such complex knowledge. It's really about the application. And you'll find that's the case. If you talk to most therapists, they'll say the application is why people come to therapy, because the principles are one thing, but figuring out how to make it work in their own life, because each person is unique and has a different set of skills and values and context and relationship dynamics with family and loved ones. So this is where it gets tricky. But in true fashion, as a therapist, I'm going to give you some homework, okay? So we call this practice. So the practice for this skill set we just discussed is going to be to identify your unhealthy or unhelpful thoughts. You can do this by a little exercise, a little mental exercise. Try to reflect on a time in the last few weeks where your mood was noticeably low, right? That shouldn't be too hard. With your mind's eye, try to recall the details of the situation and context, such as where were you? Why were you there? Who were you with? What was happening before, during, and after that caused you to feel so triggered? So if you just kind of list things out in bullet point fashion like that, kind of like remember in English class in college or high school, the whole who, what, when, where, how, it's the exact same thing, except you're just going back in retrospect and saying, okay, so who was I with? What was going on? What was I doing and why was I there? That'll give you a lot of insight. In fact, if you sit with a therapist and one of the first things they ask you is what? Well, how was your week, or however long it's been since you've seen them? And I don't know about you, but if it's me, I can't remember what I had for lunch last Tuesday or even yesterday or what was going on. I have to sit there and really rack my brain. It happens all the time when I come into work. My colleagues are like, oh, how was your weekend? And I'm like, I don't know. I can't remember. And then I have to really jog my mind, which is why therapists give homework like mood scales, which are, very helpful for not just you, but for the therapist to find out what's been going on, what's been triggering you. Look for patterns and triggers and what kind of coping behavior is effective for you. If you subscribe to my email list, and I'll put all the details in the description and the episode notes, you actually get a free mood scale sheet I created, sent right to you by email. You can download when you subscribe to the email list, but we'll get more to that later. Okay, so once you've kind of got the scenario of the triggering event, the next thing you want to do is list your thoughts. Right? And I say thoughts because we have more than one thought. And one thing happens and we can have a stream of thoughts, right? Or a stream of consciousness. And not all thoughts are created equal. Some thoughts are a little, weight heavier than others. Write them out as entire statements, like we said before. A thought can either be a statement or a question. The most helpful thoughts tend to be questions, not statements. This is a crucial part of finding out what the connection is between your thoughts and emotions. We have to work backwards. A helpful hint here: harmful or unhealthy thoughts are usually very negative, like duh, right? Often non-factual, self-degrading, overgeneralized, absolute, and lopsided. Remember what I said before. Healthy thoughts tend to be accurate, balanced, and complete. So great job. You made it through the first skill set, and the first pillar of skills, I should say, in CBT. Now, as we look ahead, just remember that even though this stuff may seem like common sense, it's really not so common. These skills are subject to assumption. And really, it's the pitfall of assumptions that gets us in trouble. While the notion of this relationship between our thoughts and our emotions may seem basic, the application for these skills are really quite convoluted. And we're going to be covering these over the next 11 episodes, so we'll make sure we get to all of them. And again, it's because we're not taught to think about our thinking, let alone the underlying causes of our thought process, such as rules and assumptions and how they're developed. And we'll be getting into that stuff later on, and that's really the at the core of the whole CBT model is our rules and our assumptions and how they're formed by negative core beliefs. But in the next episode, we'll be jumping into things such as how to identify unhealthy thought patterns, right? Because we all struggle with certain patterns of thoughts. And the nice thing about that is once we figure out what it is that I particularly struggle with or you struggle with, then it's a lot easier to catch them, right? We'll be talking about skills like chaining, which is a little bit of what we talked about looking, in retrospect and really breaking things down into a sequence of events to try and tease out triggers, points of intervention, so we can cope better for future implications, right? We'll be talking about the ABCs of CBT, and lastly,